Hello everybody, this is Farahati. I'm using Health Economics 6th edition by Santerre and Neun. This is chapter 8, Market Analysis, lecture 1, Perfectly Competitive Market. In chapter 3, you'll learn that the efficient allocation of resources is where we have the marginal social cost equal to marginal social benefit. And this is different than the individual marginal cost and individual marginal benefit, right? So in chapter 4, you learn that actual decisions about the allocation of resources are conducted at a centralized or decentralized level. So since the United States has basically decentralized healthcare system, our focus is to look at basically how resource allocation takes place in a decentralized medical marketplace. In this chapter, you will learn about the industrial organization, which is the study of behavior of firms and markets. So we analyze different types of market in this chapter. And then we talk, is a perfectly competitive market relevant to medical care? Now, let's start with this discussion that these days, recently, the consolidation has been increasing in medical market. So, why is it important to discuss about that? Because in health economics, we wanted to always measure the impact of any policy, new changes on the triple aim, the impact of consolidation on cost, quality, and access to care. So it is becoming an increasingly challenging to be a small medical practice because of a few reasons that I actually present here, and I found them from Ginsberg 2016 study. The first reason is challenging to be a small medical practice is transition to electronic medical records, which is expensive and requires a specialized expertise to avoid pitfalls, right? The second reason is a provider payment reforms, basically different types of payment models as a major potential to reduce the cost and increase quality. And those are also complicated and requires basically a specialized expertise. So the other reason is the lifestyle choice by younger physicians that basically they prefer to be hired by large organizations. So just basically they like to take care of the patients and leave the paperwork and all these complicated work to the organization, the management, to the organization. Now, the small hospitals and medical practices are not well positioned with these transitions of payment reform models and electronic medical records. So therefore, so you see more consolidation these days than before. So now there are different studies. They're looking at the impact of consolidation on triple aim. And one of the studies, Ginsberg in 2016, found that hospital mergers lead to higher prices without any major impact on quality. So this is very bad. That's the bad news. Now, let's just first of all analyze the market and see what type of market do we have in the United States. To analyze the market, we usually use this chart. So the chart shows the degree of market power, from 0 to 100% by looking at these characteristics. So we wanted to see if the number of the sellers, and then individual firms and type of product and barriers of entry and buyers information determines whether we have a perfect competition with 0% market power, or we have a pure monopoly with 100% market power. In the other extreme side of a spectrum, so in these two different extreme side of a spectrum, we have 0% market power, and here we have 100% market power. By figuring out these characteristics. So in between these two extremes side of the spectrum, we have monopolistic competition and oligopoly. Let's start with the perfectly competitive market. Perfectly competitive market means that there are so many numbers of sellers, they are producing the same product or services, and they have tiny market share, no market share. And the type of products they are producing or services, they're so homogeneous. So there's so many substitutes in the market. So the demand for the demand for each producer is so very perfectly elastic. Means that they have no market power. And the barriers to entry is none. There is no barrier. Anybody can actually enter to the market and produce that. And there is a perfect information for buyers to buy. The traditional example for perfectly competitive market is agricultural product. For example, the farmers for tomato. There are so many farmers in the market, basically, in the United States, they are producing tomato. There are so many of them, and their market share is tiny. So they can't impact the market by basically stopping to produce or increase their production level or decrease their production level. Their market share is so tiny, and the type of product is so homogeneous. It means that they have, the tomato. So let's talk about just not the organic tomato, just simple, traditional, generic tomatoes. They're so homogeneous, and there is no barriers. Anybody can actually go start farming for tomato, and then there is a perfect information for buyers, basically, about the tomato. In the other extreme side of the spectrum, we have pure monopoly, which is only one producer in the market can produce that product or services, and that monopoly has 100% market share, and so of course is one product or services, so by definition is homogeneous because only one basically producers producing that. There is a complete barrier to the market, either legal barrier or natural barrier, that nobody else can produce that product or services. And either there is a perfect information or imperfect information for the customer, doesn't matter, because anyway, there is only one producer producing that product or services. There is no competition here. So in between these two, we have monopolistic competition, which is closer to perfect competition. So there are many of those producers. They have a small market share. They have a little bit differentiated product. Say that, for example, some people, they preferred a branded name product, like brand name t-shirt or branded name aspirin over the generic aspirin. So they have basically, there is no still barriers to enter to the market. The other people still they can enter to the market and produce a similar t-shirt or similar generic aspirin. So they have a slightly imperfect information, the buyers, about this product, whether it is the buyers are manipulated by the advertisement, or maybe it's real, there is a difference in the product compared to the other product. And then we have oligopolies, which there are a few sellers in the market, say that 4, 5, 6 of them, they have a large market share, and they have either homogeneous or differentiated basically product, and the barriers to entry is substantial. So not everybody can actually enter to the market. Like, for example, the classic example of this is the OPEC, basic organization for petroleum, basically export countries. There are a few of them, so there are barriers to entry. Not everybody can produce petroleum because of the natural barrier. Or there may be some legal barriers. You need some licenses to produce that, basically, or a geographical barrier. And then the buyers, they have either perfect or imperfect information. Now, so there are two extreme sides of spectrum. The point here is that we prove that in this chapter that perfectly competitive market is the best ideal market, because both producers and consumers, they gain the maximum, and there is a net maximum welfare for the society by having a perfectly competitive market. So many people, so many sellers to produce that. So let's start with the perfectly competitive market. But before that, let's introduce that how we can actually analyze the market. Industrial organization is the study of behavior of firms and markets. There are 3 elements we can actually study and analyze the market. These 3 elements are market structure, market conduct, and market performance. Market structure is looking at the overall environment of the operation of each firm, looking at the number, type, size of the distribution, etc. Market conduct, looking at the pricing, promotion, and research and development activities, and market performance, looking at the end actually results of the product, the degree of production, allocative efficiency, equity, and technological progress. So we show all these elements in this big chart. Let's start with the supply and demand. That's always the main model in our economics basic analysis, right? The basic condition in industrial organization, we look at the supply and demand. The supply usually depends on the technology, unionization, legal environment, economics of scale, and demand depends on price elasticity, demand condition, and so many other factors. But that's basically the brief cases here, briefly. And then we have the market structure here, depends on the number and size of the distribution. And we have the conduct, which is the pricing behavior and promotion, etc., research development. And then the performance, the final product, how the firm is doing production in terms of production, allocation of efficiency, equity, and technological progress. There are other factors, external factors are affecting these 3 elements. One is the objectives of the firm, whether the objectives of the firm is profit maximization, quantity maximization, quality maximization, discretionary spending, others. So that affects the basically market structure, and also affects the pricing behavior. So of course, if the objective is profit maximization, is different than quality maximization on setting the price. And the other factors, such as public policy, like taxes and subsidies, and all the legal, basically, regulations, they affect the market structure and the conduct, and all of them affect the final performance. Now, let's start with the perfectly competitive market. We wanted to know, is a perfectly competitive market relevant to medical care? So we start with a model of supply and demand. is used to predict changes in the price and quantity of goods, some goods or services in a competitive market. So we always start with the model of supply and demand, and then we predict the changes in this price and quantity. Okay. First of all, let's look at the characteristics of the perfectly competitive market. So when we wanted to decide and basically compare different markets, we look at the number. The first thing you look at it is the number of the buyers and sellers. Are there a lot of many of buyers and sellers in the market, and are they price taker or price makers? If they are so many of them and they are price takers, therefore they are a perfectly competitive market. If the second characteristics, we are looking at the market share. How big is the market share for each of the firms? So if the market share is so small, then we have a perfectly competitive market. And the third characteristics we have to look at is the type of the product, whether the type of product and services are homogeneous or differentiated. So in a perfectly competitive market, we have to have homogeneous products, and therefore there are so many substitutes in the market, and therefore basically each firm doesn't have any power over basically the market, because there are so many substitutes for the product in the market. So that's not differentiated for the perfectly competitive market product. So there are so many substitutes in the market. So therefore, the demand for each of the firm is so perfectly elastic for each of the firm, right? So then we have to look at to see if there are barriers to entries. If there are no barriers to entry, then the market is perfectly competitive. Otherwise, it's not competitive and it has some market power, right? And then also whether the buyers have the full information or not, and also the objectives of the market. Is that profit maximizing or not? Now, let's just apply all of those to the medical care. So we wanted to see if the medical care is basically relevant to the perfectly competitive market. So we have massive number of sellers and buyers. Do we have? No. For the sellers, the producers, like for example, physicians, there are a few of them, not so many of them. So therefore, the providers, if we talk about the hospitals, the physicians, nurses, there are not so many sellers in the market. So they are not, so therefore, they are not basically in the medical care. We don't have a perfectly competitive market because there are not so many sellers in the market, so many producers in the market. They are not all price takers. They can have actually some power and to be a price maker, in fact, right? The second characteristics in the medical care, what is the each individual's market share depends on. Some of the hospitals, they have big market share, and some of them they have a small market share. The type of the product in the medical care could be homogeneous or differentiated. If you're talking about like for example, latex gloves, there are so many of them, right, produced by so many firms right now. But then, if you're looking at a highly specialized surgeon who can operate surgery basically on a very difficult cancer patient, maybe there is a market power in some point. Do we have barriers to entry? Yeah, of course we have legal barriers. You need licenses, basic licenses to do basically any practice any medical care, right? So there are barriers to enter to the market. And do we have the buyers? Do buyers have the perfect information in medical care? No. there is no asymmetric information. The producers, the physicians, they have more information about the patient's health than the producers, basically. So there is no asymmetric information, and the objectives maybe for some medical care firms is profit maximization, but for buyers is basically they wanted to maximize their utility. But most of the firms, they're not non-profit, even in the United States, and they basically their objective is not maximizing the profit in most cases. And so anyway, the market clearing price is basically in the profit maximization is where the price is equal to the marginal revenue equal to the marginal cost. We wanted to see if that's the case in medical care as well. So graphically, we can see that we have the price in the vertical axis and we have the quantity in the horizontal axis, and we can say that yes, in basically we have the downward sloping demand. This is the market demand is downward sloping, means that the market demand for one specific product, right? So in a perfectly competitive market means that, for example, the market demand for latex gloves, so it's downward sloping for the market demand for latex gloves, or so say that generic aspirin. And the market supply, so market demand is downward sloping, so means that by decreasing the price, basically there are more demand for the product, and this is also the law of diminishing marginal utility. And also we have the market supply is upward sloping, which reflects the marginal private cost increases with respect to the production of additional tablet of aspirin. Yes, as basically we are producing more, the marginal cost increasing. Now, and then here we have this equilibrium at the intersection of supply and demand, the price equilibrium. So the equilibrium is at the point of C. The equilibrium price is P, and the equilibrium quantity is Q. And then this area triangle above the price and below the demand curve gives us the consumer surplus. P0 AC is the consumer surplus because it's area below the demand curve and above the price, means that the consumers are willing to pay any price below this demand curve and above that. So therefore the consumer surplus is P0 AC, consumer gaining by this price equilibrium in the perfectly competitive market by the area of triangle of P0 AC. Now the producer's surplus is P0 CG, means that the producers are willing to produce actually below this market price up to and above the market supply. For this amount of triangle is the producer's surplus P0 CG. So therefore the total net gain is P0 ACG, basically is GAC. This big triangle is the total net gain of producing in a perfectly competitive market. Both consumers and producers are enjoying of this net gain of the production in the perfectly competitive market, right? In the comparative static analysis, so we use the model to study the model of supply and demand to study changes in price and quantity is referred to as a comparative static analysis, and the changes in market condition influence the. So if there is a change in the market condition, because of any factor, then influence the position of demand and supply, and affect the equilibrium level of the price and outcome, then basically the market price and output changes, and we study that right now, how we can adjust basically the price and outcomes to clear the market from shortages and surpluses. So the comparative static analysis examines the changes in market condition and consequent effects. So in the comparative static analysis, we say that we have the factors that changes the supply. For example, the main very important factor is the input prices and technology that shifted the supply to the right or left. For example, if the main input prices in any production is the wages and salaries of the workers. So say that if the input prices, for example, the wages of the nurses increase, this will affect negative effect on the supply, means that makes the supply to shift leftward. And if the input price decrease for any reason, for example, say that the wages of nurses decrease, this shift the supply curve to the right. The same thing for technology. Always the cost-saving technology shift the supply to the right, and cost-enhancing technology shift the supply basically to the left. So let's see here. The factors that change the demand are the number of the buyers, consumers' taste, income, and the prices of substitute and complements. Now, this number of the buyers in the medical care could be the number of the patients. By aging population, so our demand curve shifts actually to the right. By increasing the population's income, the real national income, the demand shifts to the right, and by changing the prices of related goods and services, the demand may actually shift to the right and left. For example, greater buyer income shift the demand to the right, and by rightward shift of the demand, we have a higher price and quantity, and we show that graphically. Cost-saving technology shift the supply to the left, and we end up with a decline in price and increase in quantity. And let's look at it basically graphically. So suppose that we have initially we are in the equilibrium of point A at the intersection of supply and demand, and suppose that there was a increase in supply adoption of cost-saving technology. There is a cost-saving technology, means that there is a basically new technology that in medical care is decreasing the costs. Say that computer is decreasing the cost in any type of services. So that actually shifts the supply to the right, because by this new computer, we can supply more. So the supply shift to the right, and we actually shift from the quantity shift from A to B, right? So the quantity shifts from A to B, and at the beginning we end up with the temporary excess of supply, right? There is an excess of supply of A, B that the producers, they cannot sell. So this invisible Adam Smith invisible hand tells them which is basically the price signal tells them you have excess supply, so you have to decrease the price to be able to sell your surpluses here. So the producers are decreasing their price, and then also these invisible Adam Smith invisible hands telling to the customer that, hey, there is a better technology, and if you wanted to have actually that better technology, so basically they see that they can actually have more of these services by lower prices. So initially the price basically the quantity moves from A to B, from Q0 to Q2, and then we have excess supply, and then to be able to sell these surpluses, the producers are decreasing the price, and then so they can actually sell and reach to the equilibrium, the full amount at the point of P1 and Q1. So what happened? First, we have by adoption of the cost-saving technology, we have a rightward shift of the supply. So the quantity increased to Q2 here, right? And then there is an excess supply of AB here. They can't sell it with this price. So then basically the producers decreasing the price to P1 to be able to get rid of that surpluses. So then basically we have the initially P0, Q0, and then the final move will be in P1, Q1. Now suppose that we have a cost-saving technology which shifts the supply to the right, and then also we have a rise in the real income, national income, from D0 to D1. So initially we had that rightward shift of the supply because of the cost-saving technology, and then because of the national income, basically everybody's income increased over the time. So we have a rightward shift of the demand to D1, from T0 to D1. So therefore, initially we are in the equilibrium A, and then remember with the rightward shift of the supply, we first go from A to B, and then so we come here basically to C, and then if we have the rightward shift of the demand curve, so then we actually depends on how big is this rightward shift of the demand curve. If the shift in the demand to the right is equal to the shift of the demand to the supply to the right, so then we actually end up to point B. So therefore the price starts from P0 and end up to P0, but the quantity definitely increased. So the supply increases from S0 to S1, the price decrease, quantity increase, and then then we have the demand increases from D0 to D1. So then we have the price basically increase, because for the demand curve, when we have a rightward demand curve, both of them, price and quantity, they move in the same direction, unlike the supply curve. Now, so depends on the size of the shift, whether the demand shifts to D1 or D2, then the final change in the price and quantity determines. For the price, we don't know, depends on the size of the shift of the demand and supply. For the quantity, definitely, if we have the rightward shift of the demand and supply, the quantity definitely is going to increase, but the price is questionable and depends on the size of the shift of the demand and supply, right? In the long run, in the dynamic analysis, we say that there are basically entry and exit in the market. For example, in a competitive market, if basically a market is very profitable, so then the other firms, because there is no barrier to enter, right? The other firm, they see the signal, Adam Smith, invisible hand, is telling them that there is a profit in this market, and they enter to the market. So they actually, they shift the supply curve to the right. So the shift, the short-run supply curve, basically, if there is a market is profitable, so they actually, the supplier, they are in the market, they increase their basically supply. And also in the long run, there are new firms, they're coming to the market and they're producing the same product. And so what happened in the long run, because there is no barriers, so many of these new firms are coming to the market, and eventually what happened, basically there's no profit anymore because there are so many of them in the market. So in the long run, some of them, when the profit is basically reached to zero, means that the economic profit equals to zero. When we say economic profit is equal to zero, means that the opportunity cost of all the input prices basically covered by that profit. So then when the signal is telling you that there is no more profit in the market, so then the firms are exiting from the firm. So then again, that raises the price and eliminates basically when the economic losses, when there are more firms in the market. Now, so that actually happens empirically. We can say that when there was an excess profit or high rate of return in the market, good example would be when at a time there was a prevalence of AIDS and hepatitis B, and the demand for disposable latex gloves increased. So what happened, it was so profitable, the market for latex gloves, and then so the new firms, they entered to the market and to produce these latex gloves, and then basically they entered to the market up to the point that the rate of return was almost zero, the economic rate of return, and then so basically they had to exit from the market. So basically the firms enter to the market up to the point that there is a normal profit exit, and that profit basically determines whether the new firm enter to the market or not, because there is no barrier, right? Anybody can enter to the market. As long as the profit is positive, the new firm enter to the market, and when the profit is actually zero, then they stop to enter to the market, and even some of them, they exit from the market. Now we wanted to use the supply and demand to explain the rising healthcare costs from 5.1% of GDP in 1960s to 17.4% in 2013. So from the demand side, we have we know that there has been a rising income, and aging population and declining the out-of-pocket, all of them, basically they shift the demand curve to the right. And by shifting the demand curve to the right, so there is a higher prices and quantity of medical care demanded, right? Both price and quantity actually increase. By rightward shift of the demand curve, we have both price and quantity increase. From the supply side, we have a wage increase in medical care industry, which is unmatched with the increase in the productivity caused by the technological advance. So we have a supply curve shift to the left because of the increase in input prices, right? So, and then we have the price of medical care increase, and then we have inelastic because of the inelasticity of the demand curve. By rightward shift of the demand curve and leftward shift of the supply curve, we end up with a high increase in the healthcare costs from 5.1% of GDP to 17.4% in 2013. So so this is the activity one, comparative static analysis. Let's look at the using the supply and demand to explain the rising healthcare costs. So we wanted to see what happened if there is a decrease in the wage of clinic-based nurses. So this is clinic-based nurses is one of the input in the healthcare basically production, right? So what happened by increasing the wages for nurses? You're expecting the supply curve to shift to the left, right? So then you have to show the price. What happened to the price? In that case, we have a decrease in the wage of the clinic-based nurses, shift the supply to the right. So there is a rightward shift of the supply curve. And then this makes the price decrease, the quantity increase. So the second actually example says that the adoption of cost-enhancing medical technology makes the supply curve to shift to the left. So this ends up with the increasing the price and decreasing the quantity, and an aging population and correspondingly more basically more severe patient case mix, shift the demand curve to the right, the supply shift to the left because of the why? Because we have basically more sicker labor forces. And then here, the price definitely increased, but the quantity depends on the size of the shift of each of these supply and demand. Declining the income, the consumer's income means that the leftward shift of the demand curve, and then the price decrease and quantity decrease. Remember, when the demand shifts, the price and quantity, they move at the same direction. When the supply shifts, the price and quantity, they actually move in a different direction. Just pay attention to that. A lower market price for physicians' services is complicated. Depends on, basically, this is actually a tricky question because the physician services prices determined by intersection of supply and demand. So that's the tricky question. The effect of obesity is increasing the demand for basically healthcare expenditure, and higher quality of medical care means that basically rightward shift of the supply curve. And so, of course, using the supply and demand to explain the rising healthcare costs, we can see that by cost-enhancing technology is different than the cost-saving technology. So by higher quality of medical care, but higher cost, then we have the supply curve shift to the left and the demand curve shift to the right, and then so because of the everybody wants the better quality and higher technology, so everybody these days wanted to have the knee replacement. So This higher medical expenditure is explained by shift rightward, by the leftward shift of the supply care and rightward shift of the demand care.